I want to lead off with the most common question, and that is, at what age is CBT appropriate? Can it be used with children and adolescents? And if so, what modifications might need to be made?
I think CBT can be used, especially from, I would say, if you really focus on CBT for an individual, you can do that from 9, 10-year-old onwards. If you think about CBT or behavioral therapy for children with ADHD, often it is parent training or training the teacher. So it's more focused on the environment. But actually you can also explain parents about the neurodiversity perspective and seeing their child as different and not a child with a disorder, and how they can adapt the environment for their child so that that their child can thrive in daily life. So that's really about teaching the parents to look at their child with realistic expectations. What can my child do? And how can I adapt the environment towards my child so that this difference is not necessarily disabling for my child? So I think it doesn't really matter who you provide the intervention or support to, but from this perspective, you can do it in the same way.
Okay, that's helpful. And any advice on getting a child, or more likely an adolescent, teenager, to willingly engage in CBT? Whether it's talking points or benefits that might help to persuade them.
Mm-hmm.
I think the biggest thing there is tying it back to their teens' goals. Like, what is it that, are they having difficulties with? What benefits might it have? In framing it in that way, that again, this isn't necessarily a deficit or something that you're going to therapy to change you, but are there ways that maybe someone could help you make your life easier, help you achieve your goals, but really tying it back to that and having it be more of a collaborative stance rather than more of a you're going because I'm telling you you're going kind of situation. I don't know if Saskia or Dr. Van der Oord, do you have other things you want to add?
Yeah, I think it all comes back to adolescence. For example, when you talk about planning an organization, there's often when you ask adolescents, they do want to stay in their class with the same classmates. That's a goal. If they find that a goal and you say, okay, how can we make that happen? What is for you an important goal to come to me, or that I can help you or support you? And there are always goals for them. They say, oh, I don't want to get in too much fights with my parents. I really don't like it because they're grumpy with me all the time. If that's a goal, then that's a goal. But it's not necessarily the goal that you as a parent think that is important, or that the teacher thinks that's important. There's always a goal for themselves. Everyone has a goal. But it may appear not to be the goal that you find important. And I think that is really important in talking to adolescents and working with adolescents.
Okay, that's very helpful. Thank you. Now, I know today's presentation was clearly not about medication. However, a number of people are wondering if there is any research, any science to suggest that CBT is more effective when used in conjunction with a prescribed ADHD stimulant or non-stimulant.
I think a lot of it's personal preference. I think stimulants are effective for some. Adding, I think, in my take or perspective is that the foundation should be the CBT, because medication isn't necessarily going to teach you the skills of what you should focus on or what you should prioritize rather may just help with those symptoms of ADHD, that attention piece. So it may be helpful for some that are really struggling with severe symptoms of ADHD that may be getting in the way of using some of these CBT skills. But I think that in general, it should always be a both and rather than an either or. That I think learning these skills in conjunction with taking medication is going to be the best. But I think for many, the CBT skills alone can be just as effective. I think it just depends on, are there, certain symptom type barriers that are causing them difficulties with engaging with some of these skills.
Mm-hmm. That makes sense. Okay. I did want to turn to someone who has used CBT in the past. I'm guessing not with an ADHD trained provider, but they said that their depression and their sense of failure were triggered by sort of, as you suggested, not being able to keep up with that homework and also not being able to necessarily use the time management and prioritization strategies in real time. The emotional flooding or what have you, getting in the way, and that triggering negative feelings. This seems to be a common theme here today. So I'm wondering if you can address ways that ADHD-informed CBT can really help with this, what might be classified as sort of the rejection-sensitive dysphoria that does get triggered when you aren't meeting maybe your own expectations for the therapy.
Yes, I think this is a really important one for people not knowing ADHD. They give people homework. They talk too much. They give several strategies that people have to practice, etc. And I think this is really, really important to tailor towards people with ADHD. And there you can think of really, really tiny steps and think what would be something that is feasible and that a person can do. And for example, we work a lot with adolescents and sleep problems. And then it would be, how can you use an alarm clock as something that you do within a sleep treatment? What we do is we give them an alarm clock, because if they have to go to a store and buy one, that won't happen. And then we set it to the time they have, and then with them make a plan for how they remember to take it out of their bag when they're at home. Because I think that is the level of detail that you need for someone to really start using that alarm clock. And I think there, the people with lived experience can really help, because they know. And if you have ADHD, you know the struggles of forgetting things, etc. So there, the input of people with lived experience, of clinicians with lived experience, is also really important.
Yeah, I almost see that as a somewhat of a failing on therapists, that they're not necessarily breaking things down enough in a way that's going to work with their patients, and that we should be working to make sure the goals and any sort of outside skill practice are feasible for each individual person, and that's going to vary. And I think that I'm sorry to hear that was your experience. But I think, we need to do a better job of matching, like you're saying, Dr. Van der Oord, on, how we can best support skill acquisition outside of session. I also think, in what I do with my patients a lot is check-ins throughout the week. So rather than, a lot can happen in 7 days. And I think a lot of times having more frequent check-ins can be really helpful. In making sure that there's more touch points in between sessions. So I think that may be something that could be helpful for some, especially in the beginning when it's a new skill that you're trying to develop, and maybe there are a couple, hurdles or roadblocks that we can problem solve in between sessions to help keep you on track.
Okay, very helpful. We did have someone who wrote in to say that following their diagnosis in adulthood with ADHD, that CBT was not part of the conversation for a treatment plan. And they're wondering about ideas for talking points to bring this up with their provider. How should they go about inquiring about CBT and adding that to their other treatments?
Is this, I guess, a point of clarification? Is this provider like was it just testing, or is this like a psychiatrist? I guess because I think that not everyone is necessarily trained in CBT, so it may be, asking for referrals or I imagine that there is a resource through ADDitude or other organizations like CHAD where you can find a CBT provider. But I think not everyone, especially in that medical model, is familiar with these psychosocial treatments that have shown to be really effective.
Yeah, I think my reading was that it was a general practitioner. So I think that may be the hurdle that you've identified there, is that the patient may need to educate the provider on exactly this ADHD-informed CBT. And before we run out of time on this topic, a lot of people wondering if they would like to learn more, if you can recommend any books, websites, podcasts, places where they might begin to dip their toe, and even some interested in introducing the concept to their adolescents. Any suggestions are appreciated.
I know Russ Barkley has written some great books, more in the self-help realm. I think other resources like your ADDitude, I think CHAD, CHADD, it's also a great patient portal for folks with ADHD to connect you with providers for you to learn more. I'm also happy. I think if folks are interested, I'm happy to talk to folks as well. You can reach me through my website, which I realized wasn't on the slides, is uicadhd.org, or email me. I think those are the tips I have off the top of my head. And if you're a parent with an adolescent going to college, I'll self-plug my book here that's designed to help parents really tackle some of these conversations about sorts of skills, where they might link, find other resources, what things to look for in college.
Yes, and I think I can also give the advice. It's also on my slides, the LEANS website. So that's really explaining neurodiversity to kids, to teachers. Also, schools can apply for a package about teaching neurodiversity in schools. And there's also information for parents there, so more for the younger age. And it's really all from a neurodiversity perspective, looking at ADHD, but also autism, etc.
Okay. Excellent. Wonderful. Well, Dr. Van der Oord and Dr. Meinzer, thank you so much for joining us today and for leading this conversation about CBT. We appreciate your contributions to our ADHD community.
Thank you so much for having us.